Sarah often finds herself anxious in social situations, especially when meeting new people. According to psychodynamic theory, which of the following may be the underlying cause of Sarah's anxiety? A. Sarah lacks social skills and confidence. B. Sarah experienced unresolved conflicts during childhood related to social interactions. C. Sarah's anxiety is a result of biological factors. The answer is B. Sarah experienced unresolved conflicts during childhood related to social interactions. Explanation: according to psychodynamic theory, anxiety and other psychological issues can stem from unresolved conflicts and experiences during childhood, particularly related to relationships with caregivers and peers. Sarah's anxiety in social situations could be a manifestation of unconscious conflicts or traumas from her past interactions, which are now being expressed in her adult life. John frequently experiences intense feelings of anger and aggression towards authority figures. According to psychodynamic theory, what might be a possible explanation for John's behavior? A. John has poor impulse control. B. John's aggressive behavior is a learned response from his environment. C. John is projecting unresolved feelings from his relationship with his parents onto authority figures. The answer is C. John is projecting unresolved feelings from his relationship with his parents onto authority figures. Explanation: projection is a defense mechanism identified in psychodynamic theory where individuals attribute their own undesirable thoughts, feelings, or impulses onto others. John's intense feelings of anger and aggression towards authority figures could be a result of projecting unresolved feelings from his past experiences with his parents or other significant figures onto those authority figures in his present life. Michael often jokes about being a neat freak and gets visibly upset when things are out of place. According to psychodynamic theory, what might be driving Michael's behavior? A. Michael's need for order and cleanliness could stem from unresolved psychological conflicts related to control and perfectionism. B. Michael's behavior is a learned response from his parents. C. Michael has obsessive-compulsive disorder, OCD. The answer is A. Michael's need for order and cleanliness could stem from unresolved psychological conflicts related to control and perfectionism. Explanation: psychodynamic theory suggests that personality traits and behaviors can be influenced by unconscious psychological conflicts and experiences from childhood. Michael's behavior of being a neat freak and his strong reactions to disorderliness may indicate underlying psychological conflicts related to control, perfectionism, or unresolved issues from his past, rather than simply being a result of OCD or learned behavior. Maria frequently experiences feelings of guilt and shame, even when she hasn't done anything wrong. According to psychodynamic theory, what might be contributing to Maria's feelings? A. Maria has a sensitive personality. B. Maria may have internalized critical voices from her parents or caregivers during childhood, leading to an overly harsh superego. C. Maria's feelings of guilt and shame are a result of societal pressures. The answer is B. Maria may have internalized critical voices from her parents or caregivers during childhood, leading to an overly harsh superego. Explanation: according to psychodynamic theory, the superego represents the internalization of societal and parental standards, including moral values and expectations. Feelings of guilt and shame can be attributed to an overly harsh or critical superego, which may have been formed through childhood experiences where Maria internalized critical voices or messages from her parents or caregivers, leading to her heightened sense of guilt even in situations where it may not be warranted. David has difficulty forming intimate relationships and often pushes people away when they get too close. According to psychodynamic theory, what might be a possible explanation for David's behavior? A. David has a fear of commitment. B. David's behavior is a result of his personality traits. C. David's difficulty with intimacy could stem from unresolved attachment issues or fear of abandonment from childhood. The answer is C. David's difficulty with intimacy could stem from unresolved attachment issues or fear of abandonment from childhood. Explanation: Psychodynamic theory emphasizes the importance of early childhood experiences, particularly in forming attachment patterns and interpersonal relationships later in life. David's difficulty forming intimate relationships and pushing people away when they get too close could indicate unresolved attachment issues or fear of abandonment stemming from his childhood experiences. These unresolved issues may be influencing his adult relationships and behaviors. Susan has a habit of procrastinating on important tasks until the last minute. According to psychodynamic theory, what might be a potential explanation for Susan's procrastination? A. Susan lacks motivation. B. Susan has poor time management skills. C. Susan's procrastination could be a defense mechanism to avoid feelings of anxiety or fear of failure. What might a psychodynamic therapist interpret if a patient frequently forgets appointments and arrives late? A. The patient lacks motivation for therapy. B. The patient is unconsciously resisting therapy. C. The patient has a neurological disorder. What might a psychodynamic therapist interpret if a patient frequently forgets appointments and arrives late? A. The patient lacks motivation for therapy. B. The patient is unconsciously resisting therapy. C. The patient has a neurological disorder. B. The patient is unconsciously resisting therapy. In psychodynamic theory, resistance refers to the unconscious defense mechanisms that patients use to avoid confronting uncomfortable thoughts, emotions, or aspects of themselves. Frequently forgetting appointments and arriving late could be interpreted as a form of resistance, as the patient may be unconsciously avoiding therapy or resisting the therapeutic process. A client consistently seeks validation from authority figures and struggles with decision-making. Which psychodynamic concept might explain this behavior? A. Oedipus complex. B. Electra complex. C. Fixation at the anal stage. C. Fixation at the anal stage. According to Freud's psychosexual stages of development, the anal stage occurs during early childhood, where focus and pleasure are centered around the bowel and bladder elimination. Fixation at this stage can lead to personality traits such as excessive orderliness or messiness, as well as issues with control and decision-making later in life. In a therapy session, a client expresses intense anger towards their partner but struggles to identify the source. Which defense mechanism might the client be utilizing? A. Repression. B. Projection. C. Sublimation. B. Projection. Projection is a defense mechanism where individuals attribute their own unacceptable thoughts, feelings, or motives to others. In this scenario, the client's inability to recognize their own anger towards their partner suggests that they might be projecting these feelings onto their partner instead. A person who experienced significant trauma in childhood often finds themselves in abusive relationships as an adult. Which psychodynamic concept might explain this pattern? A. Regression. B. Identification. C. Repetition compulsion. C. Repetition compulsion. Repetition compulsion is a concept where individuals unconsciously repeat patterns of behavior or reenact past experiences, particularly traumatic ones, as a way of mastering or resolving unresolved conflicts. In this case, the person's tendency to find themselves in abusive relationships as an adult could be a repetition of the trauma experienced in childhood. A client frequently complains about feeling empty and disconnected from others. Which psychodynamic term might a therapist use to describe this feeling? A. Ego. B. Superego. C. Egodystonic. C. Egodystonic. Egodystonic refers to thoughts, feelings, or behaviors that are inconsistent or conflict with one's self-concept or ego ideals. Feeling empty and disconnected from others would be egodystonic because it goes against the individual's desire for connection and fulfillment. A patient consistently blames external factors for their problems and refuses to take responsibility. Which defense mechanism are they likely using? A. Rationalization. B. Denial. C. Displacement. A. Rationalization. Rationalization is a defense mechanism where individuals justify their behavior by providing logical or socially acceptable reasons, rather than acknowledging the true, often unconscious motivations behind their actions. Blaming external factors for one's problems is a form of rationalization. A therapist notices that a client repeatedly interrupts the session with irrelevant stories whenever a particular topic arises. This behavior might indicate A. Transference. B. Resistance. C. Countertransference. B. Resistance. Resistance refers to the patient's unconscious attempts to avoid or hinder the therapeutic process. In this scenario, the client's interruption with irrelevant stories whenever a particular topic arises could be seen as a form of resistance, as it prevents the therapist from exploring potentially uncomfortable or threatening material. A person who constantly seeks attention and approval from others might have experienced a lack of A. Oral gratification. B. Anal retention. C. Phallic development. A. Oral gratification. According to Freud, the oral stage is the first stage of psychosexual development, where pleasure is primarily derived from oral activities such as sucking and biting. A lack of oral gratification during this stage can lead to issues later in life, such as seeking attention and approval from others to fulfill unmet needs. A client who is fixated at the phallic stage might exhibit A. Strong sibling rivalry. B. Fear of abandonment. C. Difficulty forming intimate relationships. A. Strong sibling rivalry. Sibling rivalry typically occurs during the phallic stage of psychosexual development, where children compete for the attention and affection of the parent of the opposite sex. Strong sibling rivalry can indicate fixation at this stage, where unresolved conflicts related to jealousy and competition persist into adulthood. A patient consistently dreams about being chased but cannot identify who or what is chasing them. Which psychodynamic interpretation might explain this dream? A. Manifest content. B. Latent content. C. Archetype representation. B. Latent content. According to Freudian dream analysis, dreams have manifest content, what is consciously experienced, and latent content, the underlying symbolic meaning. In this scenario, the manifest content is being chased in the dream, while the latent content would involve the unconscious fears or desires being symbolized by the chasing figure.